Hello everyone. Now we are going to see about some more terms in ophthalmology. These are asked in UMLE exams. So I will be telling you in a brief what you need to know about each of them. So how does dyslipidemia, that is any disorder in lipid metabolism, present in the eye? It can present as orbital xanthomata. What does orbital xanthomata mean? Xanthomas, the name per se means that there is cholesterol deposition somewhere. So orbital is around the orbit. So when there is a cholesterol deposition in the eyelid or around the eyelid, it is known as orbital xanthomata. So this is how the dyslipidemia presents. There is one more presentation of dyslipidemia, that is arcus senilis. Here there are lipid deposits around the cornea. So here there are lipid deposits around the cornea. But this can be even due to, even though there are lipid deposits around the cornea, this can be because of old age, like senility, or it can occur, it is associated with old age, but it can occur with lipid disorder, or even if the cholesterol is normal, in the old age, they can have this arcus senilis. That is the point I am trying to emphasize here. What about corneal abrasion? The corneal abrasion is when there is any abrasion of the cornea, that is corneal abrasion. But why should it happen? It can be because of a foreign body, or it can be because of lens. So either they can be, the question weakness can present you like the patient who has been wearing a lens and he has been having a grittiness or photosensitivity, and with the clinical features or presentation pertaining to the cornea. Or I can tell you like the child has been playing near a sandbox, the mother or the father has been was also playing with them, then they had this grittiness or photosensitivity and redness. All those symptoms can be given. In those, with all the hints, it means that they are talking about corneal abrasion. Now in that case, when you suspect corneal abrasion, what is the next step? The next step is the fluorescein dye. What is a fluorescein dye? With regard to the fluorescein dye, you need to remember three colors. So one is the fluorescein dye per se is orange in color. So when you apply it on the eye, it is blue. All the areas which are normal areas appear blue. But any corneal abrasion, that abraded area will be appearing as green. So it means that any area which appears green is abnormal, or is the one which is damaged. So this is what you should know about corneal abrasion. What do you know about subconjunctival hemorrhage? Subconjunctival hemorrhage will occur because of any trauma, obviously, right? Or it can occur because of coughing, intense coughing. It can also result in subconjunctival hemorrhage. Or it can occur because of straining, vomiting, like any reasons, like there is an increased pressure in the eye. Associated with increased pressure in the eye, it can result in subconjunctival hemorrhage. What is the treatment? Even though the eye looks red and it's quite scary to look someone like that, and our immediate urge is to treat them, but the treatment is to wait and watch, or reassurance, because it will get resolved on its own. Let's see about some iris defects. The iris defects, the most common syndrome associated with iris defects is WAGR syndrome. WAGR, W stands for Wilms tumor, A stands for aniridia, G stands for genitourinary anomalies, and R stands for retardation or growth retardation. Here, this WAGR syndrome is because of a defect in the chromosome number 11. This is what one should know. So, in those affected with WAGR syndrome, they will not be having the iris at all. So that is aniridia will be seen in WAGR syndrome. Now what is coloboma? Coloboma, when it is colloquially translated, it means there is a hole in the eye. So that's what you should know. But why does it happen? It happens because of a failure or a failure in the formation of any part of the eye. So it can be because any part of the eye may not be formed, and that is known as coloboma. Or if to remember it simply, we can remember it as coloboma is hole in the eye. So this is mostly seen in like a part of the iris will be missing. So this is also seen with iris. Now what is this coloboma associated with? The coloboma is associated with charge syndrome. Charge syndrome, C stands for coloboma, H stands for heart defects, A stands for atresia of the choana, R stands for retardation, genitourinary abnormalities, ear or eye anomalies. What about albinism? Albinism is when the pigmentation of the iris is impaired. Like the iris has to be is blue or black and black pigmented, right? When that pigment is not there, but instead when they have a pink iris, then it is albinism. Then that condition is known as albinism. These are in general about a few conditions in ophthalmology. I have a part 2 of it. Stay tuned for it. Thank you for listening all this while. All the best for your exams.